Dr. Sayan Gupta, and let me introduce myself. I'm a consultant physician who has been working in Kolkata for quite some time. Today, we're going to discuss something about this antimicrobial resistance. It's a emerging problem which has been quite a concerning factor for last few decades. And it's a burning issue. Whenever we are treating any patients, we are often encountering certain multi-drug resistant organisms which often pose huge problem for us in treating all those patients. These not only increase the financial burden of the patient, this also increases the clinical burden of the patients per se. It has been estimated that a patient who is suffering from multi-drug resistant infection, the cost of the hospitalization, it actually escalates by $6,000 to $18,000 per patient. It also increases the morbidity, it also increases the length of the stay in the hospital, it increases the mortality of the patient at least 5 times than that of the general population. So overall, yes, we are quite concerned by the increasing and the emerging resistance of the different microbial organisms against the antibiotics. What are the different types of antimicrobial, multi-drug resistant microbial organisms? We usually follow a mnemonic which says ESCAPE, E-S-K-A-P-E. E for Enterococcus faecalis, A for Staphylococcus aureus, K for Klebsiella, A for Acinetobacter species, P for Pseudomonas, and E for Enterobacter species. So what actually leads to this emerging antimicrobial resistance in the current decade? It's not only about the virulence of the organisms because of the production of enzymes like beta-lactamase, OXA48, metallo-beta-lactamase, ESBL, AMC producing organisms. It might be also because of a certain efflux mechanism or target protein alteration or mutation which actually leads to the emerging resistance against these antimicrobial agents. However, most importantly, it's mainly because of the indiscriminate, irrational use of the broad spectrum antimicrobial agents. So we should actually use that very discriminately and as per the antimicrobial susceptibility testing reports. So what can we do in order to prevent the emergence of this antimicrobial resistance and break the chain of this infection? I personally believe there are 3 pillars by which we can actually break the chain of this infection so that we can actually have a bright future. Number 1 is maintaining hygiene. So hand hygiene is very important, maintaining respiratory hygiene amidst respiratory etiquette, proper environmental disinfection by using 1:10 dilution of sodium hypochlorite solution, maintaining proper asepsis while doing all the procedures. So these things, getting vaccinated, all the healthcare providers should be actually vaccinated. So these things are very important. So this is the first pillar. The second pillar is proper and discriminate use of antibiotics. So I personally believe that every institution should actually have an antibiotic stewardship program in which we should actually analyze and reassess the usage of antibiotics, whether the broad spectrum antibiotics are at all required or not, or whether empirically we should actually use a very broad spectrum antibiotics. Assessment and reassessment of the patient is very essential. Proper dosage of the antibiotic is very essential, that is assessment. Assessment of the duration of the antibiotic is essential. Assessment of the prescription of the antibiotic and within what time the patient is actually receiving the antibiotic is very essential. Also, we should actually note the complications of the antibiotics. So antibiotic stewardship program is very important. And lastly, what I feel is recycling and the recycling of antibiotics, or this antibiotic holiday, or bringing in older antibiotics instead of the new antibiotics in order to break the chain of this infection. Finally, I would like to make a pledge, make an oath as a responsible healthcare providers along with my colleagues that we ourselves are responsible to a huge extent in this emergence of this multi-drug resistant infection. So we have to take an oath that we would be using these antimicrobial agents as per the antibiotic susceptibility testing reports, accordingly escalate and de-escalate depending upon the surveillance culture report, and we would be discriminately using these antimicrobial agents and responsibly using these antimicrobial agents so that we can actually present a better future for our future generation. Each and every hospital should have an infection control team where an infection officer and the infection sister, control sister should be present. They would be regularly giving a daily round of the patients who are receiving these antibiotics. They would be assessing and reassessing the requirement of the antibiotics, whether any escalation is required or any de-escalation is required. They would be collecting the microbiological data and accordingly publish the monthly data in order to find out the local epidemiological flora, microbiology flora, so that any hospital can actually modify the usage of the antibiotics. This is absolutely essential and this is very much an integral part of the antibiotic stewardship program. Thank you.